Good day, Mrs. Ryder. I'm Frankie. I'm going to present the healthcare and hospital personnel industry. Anticipating health hazards and recognition activity is important. It might minimize costly retrofit and reduce all the risk to protect health of workers. Generally, there are 5 types of health hazards. The physical hazard which might affect hospital personnel are ionizing radiations, non-ionizing radiations, and lightning. The example for ionizing radiation will be CT scanner, fluoroscopes, and nuclear medicine bone scans. The example for non-ionizing radiation will be magnetic resonance imaging (MRI), ultrasound, and laser. Exposure to high level of radiation can cause acute health effects such as skin burns and acute radiation syndromes. Dosimetry is used to assess radiations. To carry out dosimetry monitoring, dosimeter is worn to measure the amount of exposure. Furthermore, improper light control can leave surgeons with lighting difficulties during surgeries. Nurses will be exhausted and stressed in dim conditions. Lighting assessment can be carried out by using 2 approaches, which are walk-through inspections and lighting measurements. Walk-through inspection able to identify the existing light conditions. Light measurements verify illuminance levels for all the activities involved in interrelated work. Illuminance can be measured by using lasmeter. There are 2 types of lighting measurements, which are general lightnings and general areas and specific activity at workstation area. Second, the use of chemical is widespread in healthcare sector. The use of chemical includes cleaning reagents, sterilizing agents, laboratory chemicals, medical gases, cytotoxic drugs, and pharmaceutical substances. Chemicals can enter our body via various routes, such as skin, noise, mouth, mucous membranes, and placenta. Chemical has potential dispersed into the air in the form of droplets or vapor. Therefore, we might accidentally inhale the chemical substances. Chemical might cause health effects such as respiratory sensitizer, skin irritants, burns, or poisoning. Therefore, there are 2 types of sampling method, which are area sampling and personal sampling. For area sampling, the device is located at the fixed point approach to the contaminant sources. However, for personal sampling, the worker is attached with the sampling heads within the breathing zone. According to Manual on Simple Risk Assessment and Control for Chemical, CIRAC 2019, there are 7 steps in chemical risk assessments and control. Third, biological hazard. Healthcare workers or hospital personnel are easily co-infections to many biological hazards, such as HIV, hepatitis B, herpes and tuberculosis, if the appropriate preventive measures are not taken. Hospital personnel may be exposed to biological hazards through the contact with bodily matters, such as blood, tissue, saliva, mucus, urine, and feces from the patients, because all these substances got high risk of containing virus and bacterial disease. Therefore, health surveillance needs to be carried out for those workers who exposes in biological hazards. Health surveillance helps to identify where more needs to be done to control risk and where early signs of work-related ill health are detected. Employers should take action to prevent further harms and protect employees. Furthermore, Barker micronuclear symptom assay may also need to be carried out for studying DNA damage, cell death, and regenerative potentials of buccal mucosal tissues for those workers who subject in biological hazard. Fourth, hospital provide many ergonomic hazards, especially in patient handling, outward postures, and prolonged standing. Hospital employees may expose to injuries during handling, transferring, and repositioning of patients. Besides that, outward postures may contribute to muscles and tendon fatigue. Prolonged standing at work will contribute to serious health outcomes such as lower back and leg pains. Therefore, initial and advanced ERA need to be carried out. Checklist for outward postures and checklist for static and substandard work postures is required to identify whether it requires advanced assessment or not. Advanced ERA need to be implemented due to the risk factors are significant or over limits. There are 2 common techniques in risk identification, which are reactive and proactive techniques. The risk assessment for standing at work can depend on severity of problems and classification of risk. Lastly, according to WHO, stress, shift work, and long working hours might cause psychosocial harms, especially during these COVID-19 pandemic issues. Stress commonly follows intensive shift work and long working hours. The increased stress risk can cause difficulties in investing biological circadian rhythms, reduced strength and poor quality of daytime sleeps. Psychosocial hazard assessment should include data collections and monitoring of existing control. There are 4 steps in psychosocial hazard assessment, which are identify hazard and risk control, assess risks, control risk, and lastly monitor and review effectiveness of control. That's all for my presentations. Thank you.
Good day, Dr. Farida. I'm LIEW and I would like to demonstrate the health hazards in road construction. At the beginning, noise, heat stress, and vibration are the physical agents of road construction. The machines and vehicles used can produce high noise level to workers, which may cause noise-induced hearing loss, occupational noise-related hearing disorder, and tinnitus. Therefore, area and personal monitoring should be taken. The area monitoring should be determined by measuring at different times or areas during road construction, whereas noise mapping is operating to visualize the workplaces and noise exposure levels on a general layout plan and can be prepared by demarcating the workplace with color zone. Personal monitoring may be conducted in working hours by using noise dosimeter, which placed on shoulder after a similar exposure group had chosen the most exposed workers. After noise levels are collected, calculate the daily exposure level and daily personal noise dose and compare with the noise exposure levels. Besides, heat stress may occur due to long-term exposure under hot climate and working near the Alsford mixing plant. Thus, checklist is used to identify and determine the thermal risk. Using dry bulb sensor, natural wet bulb sensor, globe temperature sensor, and air velocity sensor to measure the BBGT index and add up the cooling adjustment factor to calculate outdoor the BBGT. The result is then compared with the threshold limit value and action limit in order to evaluate the risk either in low, medium, or high. Hand arm and whole body vibration occur due to usage of hand power tools and machine vehicles. Transducer, amplifying device, level indicator, and signal analyzer are the vibration measuring equipment which used to apply at the machines or vehicles and the fingers or arms of workers. Record the data such as duration and characteristics of the vibration sources and compare with vibration limit. Next, chemical agents such as silica and asbestos fiber will release when road paving and maintenance process, and entry by inhalation and thermal absorption of workers. Area and personal monitoring shall be conducted, such as sampling collected in specific workplace and dust samplers placed near to workers' briefing zone. CIRAC is used and the risk is dependent on hazard and exposure by categorizing the H code of chemicals into each hazard groups. Determine the scale and duration of use, then checking the vapor pressure and control approach can be decided. Biological hazard can be caused by unsanitary environment, moles, stinging insects, harmful plants, and body fluids of bloods of workers. Skin allergic and irritation, toxigenic and pathogenic responses, and viruses can be the effect of those agents. Health surveillance and buccal micronucleocytome should be used to monitor worker before, during, or post-stage of construction. Health surveillance could include examination and questioning about health complaints and identify early signs of workers in order to protect them. On the other hand, ergonomic hazards happen due to cumulative outward pushers, unsuitable tools, and repetitive tasks, which bring cumulative trauma disorders. Initial ERA, which using specific checklists is conducted, but when the risks are significant, advanced ERA should be implemented. At the end, psychological hazards which bring by excessive workloads and work overtime can cause cardiovascular and musculoskeletal diseases. Thus, the base data analysis should conduct before construction, whereas questionnaire or checklists must implement during or after construction to assess the risk faced by the workers. That's all of my part. Thank you.
Good day, lecture. I'm Cheng Fong, Year 3 student from Arcade 07. Today I want to present about the hazard, the anticipation and recognition activity of iron and steel making plant industry. So there are 5 types of health hazard in the accordingly. First is the physical hazard. Physical hazard factors are conditions within the environment that can harm our health. The common factors are noise, vibration, and radiation, and I will only discuss noise and vibration in the following. For noise, accordingly to industry code of practice for management of occupational noise exposure and hearing conservation. Excessive noise means daily noise exposure level exceeding 82 dBA or daily personal noise loss exceeding 50% of maximum sound pressure level exceeding 115 dBA at any time of back sound pressure level exceeding 140 dBc. Besides, excessive noise can lead to temporary or permanent hearing loss or tinnitus. There are two types of hearing loss, which is conduction types and sensory neural. Conduction type is breaking ear of eardrum, while sensory neural is damage to hair follicle in the inner ear. Thus, methodology of noise risk assessment consists of area and personal monitoring. For area monitoring, it determines noise sources levels, including noise emitted by machines. For personal monitoring, it measures the worker's exposure to noise during entire work shift. Furthermore, exposure of worker to hazardous vibration is classified into hand, arm, and whole body vibration. Hand-arm vibration comes from the use of hand-held power tools and it causes significant ill health. Whole body vibration is when the body is supported on the surface that is vibrating. Long-term exposure to vibration can cause nerve damage, especially in the hand and fingers. Hand-arm vibration symptom is right finger, while whole body symptom is fatigue, headaches, and loss of balance. The vibration risk assessment should identify where there might be a risk from vibration and who is likely to be affected. Contain a reasonable estimate of employee exposures. Identify what needs to do to complete with the law, example, whether need vibration control measure, and identify employee who needs to be provided with help, surveillance, and whether are at particular risk. Second is a chemical hazard. According to OSHA, chemical hazard and toxic substances pose a wide range of health hazards and physical hazards. The type of chemical hazards are chemical in the workplace and inhalable agents. Chemical burns, blindness, and lung harm can all result from incorrect handling. Toxic such as overdose can lead to life-threatening disease and lung problems in workers. Silica dust is most harmful to lungs and cause silicosis. Acid like chlorine can cause skin, eyes, and respiratory irritations. According to health and safety authorities, there are 5 types to assess the chemical hazard. Step 1. Identify the chemical hazard associated with the activities. Step 2. Consider who might be affected and how they might be harmed. Step 3. Evaluate the risks and decide on precautions. Step 4. Document and implement the findings. Step 5. Update and review the risk assessment. Third is the biological hazard. According to occupational safety and health culture, biological hazards refer to organisms or organic matters produced by these organisms that are harmful to human health. These include parasites, viruses, bacteria, fungus, and proteins. In the industry, bacterial disease like tuberculosis can exist, while virus disease like hepatitis and dengue can exist. The biological risk assessment is used to appropriate respiratory protective equipment is important for the securing and protections. Fourth is the ergonomic hazard. Ergonomic are the physical factors in the environment that may cause musculoskeletal injury. According to OSHA, ergonomics is the science of fitting jobs to workers instead of trying to get the workers to fix the job. The type of ergonomic hazard exist in the industry is manual carrying and lifting. For manual carrying and lifting can have serious consequences, example, back injury. Poor posture can also affect the musculoskeletal system. There are 5 types to conduct ergonomic risk assessment. Step 1. Review existing data. Step 2. Choose tooth. Step 3. Gather substantive data. Step 4. Gather objective data. Step 5. Analyze all data and prioritize risks. Fifth is the psychosocial hazard. Psychosocial hazards are factors in the design or management of work that increase the risk of work-related stress and can lead to psychological or physical harm. It can also adverse effect on employee mental health or well-being. These hazards are due to shift work, workload, harassment, recriminations, bullying, and stress, etc. There are 5 steps to conduct Psychosocial risk assessment. Step 1, identify the hazard and those at risk. Step 2, evaluate and prioritize the risks. Step 3, decide on preventive action. Step 4, take action. Step 5, monitor and review. That's all for my presentation. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad RIDHWAN bin RASUL. I would like to present my part, which is palm oil plantation. For the introduction, the issue of safety and health of workers in palm oil mills are being less highlighted compared to other industry. Each accident that occurs can be closely related to hazard and risk. Malaysia has been long recognized as one of the leading producers and exporter of palm oil in the world. There are 5 types of health hazard. The first one is physical hazard. Physical hazard which might affect the palm oil plantation are working under extremely hot temperature. Working under hot condition will increase your pulse rate, strain the heart, and in severe cases may cause life-threatening heat stroke. The environmental temperature can be monitored by several steps. First, place the thermometer 5 feet above the group. Second, the thermometer must be placed in the shade. Third, make sure the thermometer has a good flow. Fourth, place the thermometer over a grassy or dirt surface. Lastly, keep the thermometer covered and record the reading every hour. Furthermore, during the collection process of the palm oil, the truck will be very noisy and vibrate. Exposure to excessive noise may cause poor concentration, productivity losses in the workplace, cardiovascular disease, cognitive impairment, tinnitus, and hearing loss. Vibration can cause changes in tendons, muscles, bones, and joints and can affect the nervous system. Sound level meter can be used to monitor the sound level that is produced by the vehicles. According to Occupational Safety and Health Noise Exposure Regulation 2019, the daily noise exposure limit shall not exceed 85 dB and cannot exceed 100. Next, chemical fertilizer used in palm oil plantation are urea, ammonium nitrate, and others. These agents can bring an acute or delayed effect to the worker. Some are safer than others, but to some workers who are more sensitive to chemical, even common solution can cause illness, skin irritation, or breathing problems. Consequently, carcinogenesis and mutagenesis may begin by the workers due to a long-term exposure to herbicides and pesticides through dermal absorption and inhalation. If chemical spillage occur, nearby water sources may be polluted due to surface runoff of the contaminated soil. This can affect the drinking water quality of workers. Next is biological hazard, include bacteria, viruses, parasites, and mold or fungi. They can pose a threat to human health when they are inhaled, eaten, or come in contact with skin. All palm plantation workers were found to be at risk of illness like food poisoning, tetanus respiratory infections, or parasite infection, and infectious disease such as malaria and leptospirosis. Leptospirosis is a severe zoonosis that is transmitted through animal hosts. In addition, plantation involve the generation of a variety of dust that present potential hazard to the health of worker. This include dust and other particulate matter, zoonosis, bite and sting, as well as vector-borne disease. The lung of worker can be affected by exposure to harmful agent, to acute short-term injury to the lung, or the development of long-term injuries such as chronic obstructive pulmonary disease, asthma, organic dust toxic syndrome, and acute allergic alveolitis. According to Safety and Health Agriculture, the competent authorities should establish safety standards regarding occupational exposure to dust in the agricultural environment. Next is agronomic hazard, one of the common risks which happen to all palm plantation workers. During the harvest season, the harvester will use a sickle attached to a long pole and cut the fresh fruit bunch with a pole cutting motion. During the harvest process, the harvester often has to be in an outward position to take control of the long sickle. Fertilizing activities are performed manually in most of all palm plantation, whether smallholder, operated, or large estate. This will cause musculoskeletal disorder. Prolonged standing at work will contribute to serious health outcomes such as lower back and leg pain. In order to assess the agronomic hazard, questionnaire, observation, video analysis, and electromyography can be used. Lastly, stress and mental health disorder may cause physico-social hazard. Poor mental health was a concern for palm oil worker and employer because of the long-term burden of illness and resulting loss of productivity, high demand of manual labor, the risk of MSDS, infections, and poor living conditions coupled with low wages, long working hours, and precarious work can be major stressor for all palm plantation workers. Physical social hazard can be assessed or monitored by using had surveillance or communication among each other. That's all for my part. Thank you.